Welcome to Staying Connected, a podcast where I talk to people about their stories with VEDS, Marfan, Loeys-Dietz, and related vascular and aortic connective tissue conditions. The views, information, and opinions in this podcast are those of the individuals involved, and the information presented does not constitute medical or other professional advice or services. Welcome back to a new season of Staying Connected. This season, you'll hear from 7 people in our community about their stories with VEDS, Marfan, and Loeys-Dietz, including 2 people who have a variant of uncertain significance, or VUS, on COL3A1, the gene associated with VEDS. Today, we're going to kick off the season by talking with Carlos Horn, who was diagnosed with VEDS in 2023. Before we get into the interview, I am very happy to share a new way to support the show. Merch. Staying Connected now has merch, including tote bags and t-shirts and several different designs, which you can use to share your story or raise awareness about these conditions out and about. There will be a link to the store in the episode show notes, and I expect more designs will be added as time goes on. If you like this show and you want to help our communities raise awareness of VEDS, Marfan, and Loeys-Dietz, you can also still join the Patreon. It's a fantastic way to support the podcast, and the show wouldn't be possible without the continued support of my subscribers there. If you've already been supporting the show there, thank you. Let's get into the interview. Thanks so much for joining the podcast to share your story with Vascular Ehlers-Danlos Syndrome, or VEDS. Do you want to introduce yourself to people who don't know you already?
Sure. My name is Carlos. I'm 46. I was recently diagnosed with VEDS, Vascular Ehlers-Danlos Syndrome, and I was born, so I'm originally from Los Angeles, but I lived in Arizona a lot of years. And
you said that you were diagnosed recently. Like, how recently was this diagnosis?
It was in the early part of last year, so 2023.
So how did this diagnosis come about for you at mid-40s? Like, how did this happen?
So interesting thing, I had a stroke when I was 38, so it was around 2016 or 17, so roughly around 38, and went to the hospital. It wasn't a major stroke, but it was a stroke. I was impaired from any type of movement or anything for a few seconds, so it was pretty scary. But I've never experienced it, so I didn't think much of it because I was able to kind of catch my breath, catch myself, sit back down, and kind of shake everything off after a few minutes and resting for 15, 20 minutes. So I didn't think much of it. But I was having some other type of complications as far as my health goes. So I went to see the doctor about a week later and mentioned it. And we started running some, he requested a bunch of MRIs and CAT scans because of the stroke in my head, and saw it was a stroke. But again, he mentioned that it was small. He didn't really think nothing of it either. He just said possibly because of the scarring, and there wasn't major signs of it. But when I was also complaining about my other issues, I think it was stomach issues at that time, he had requested a full body scan, and I forgot at that time whether it was CAT scan or MRI or both or whatever it was. But later on, he had come back and mentioned that I had the aneurysms and also blood clots. So we addressed the blood clots. He put me on blood thinners, but he just said, let's progress. Let's keep progress on it, and hopefully it progresses and the blood clots go away, take care of themselves, and let's just keep an eye on you. But we didn't really get into any details, and it wasn't, it was more of like, I guess because I was healthy, and they didn't see much or a need to check into it much further. We kind of put it on the back burner and just said, let's just monitor you, right? I moved to Arizona. My insurance changed, so I had a couple different doctors between that time period of me moving back to California. And when I moved back to California, I was healthy, so I was always into the gym. I was into CrossFit. I was hitting it hard, pretty good at that time for about a year straight, going 4 or 5 days a week. I was watching my nutrition, so I was to myself. I was doing jiu-jitsu at the same time. I was healthy. I was like, okay, I'm on top of. I feel young. I feel good. Yeah. And all of a sudden, I didn't. at one time, it just came to me. I didn't feel good at all, like terrible. And I had no reason why. I didn't know why I was feeling bad. I just was, and it was feeling really bad, somewhat like a bad hangover. And that was going on for a couple of days. My sister suggests to go to the hospital or go tell my doctor, check for the blood clots. She's a nurse. So she said, ask me about the blood clots and check into all that stuff. And I ended up calling, and they sent me to urgent care instead. So I went to urgent care, and my blood pressure was really high, and I mean extremely high. And before that, I had a couple of blood pressure problems. I mean, it wasn't major, it wasn't where they were like, oh, well, we need to put you on blood pressure meds. It was more like, lose some weight, or, if you keep up the weight and keep up the high blood pressure, we may need to put you on meds. But I lost the weight, so we didn't see no need. And also, a lot of times they would take my blood pressure and then wait and then take it again. It would be down. And so we kind of just blew it off, right?
Yeah.
So I go to the doctor at that point, urgent care, and they're just feeling bad. So basically, at that point, I think at that time I was working with the nurse, and she had mentioned that, okay, she gave me some aspirin. She's like, well, we may need to put you on some blood pressure medicines, but let's monitor it. Let's just see if it's a one-time. Go home, make sure you rest, and then if it's high again, come back in, and then we'll see about getting you into the doctor and see if we can get you on some blood pressure medicine, because we can see that, obviously losing weight's not going to fix it because you're not obese. I mean, I was a little overweight, but I mean, nothing to the point where we had to worry about it. The next day, it was literally the next day, I just felt like terrible. It's hard to explain it. If you have really, really hard blood pressure, you would know it and understand it. But it's like you feel really out of energy, tired, exhausted, like you really don't want to get out of bed. And kind of like not too bad of a hangover, but really like lightheaded, I want to say, maybe. I don't know. It's tough to explain the feeling physically. But I felt just bad, and I just told my sister, I'm going to go. And I called the Kaiser and the nurse said, come into ER immediately. So I went into the ER, and that was the doctor so thank him. I thank him, and I appreciate he was there. That was the doctor that kind of opened my eyes and said, he came in with my chart and said immediately off the bat, before we even did anything, he said, well, you had a stroke. You should be on aspirin. You should be on high blood pressure medicine. We should be monitoring. You should be on a preventive maintenance plan and whatnot. And I'm like, okay, maybe I should be, but, I'm not a doctor. So.
Yeah. How much time was between when those, because you mentioned these aneurysms that they found before, and then you moved to Arizona, and then eventually you moved back to California, and that takes us to where, you're having this experience that you're talking about now, and you're in the hospital, and this doctor's like, whoa, hey, there's a stroke in your chart, there's aneurysms in your chart. Like, how much time is between these events?
So that diagnosis, and when I was working with my doctor at that time, was in 2017. Between 2017 and 2018. So roughly around 4.5, almost 5 years.
Yeah. So continue then. I just wanted to get a better understanding of that time span. And then we'll talk more about the aneurysms.
Yes. So, at that point, he said he wanted me, he put me on, he come in, he wants me to rest. They put me on blood pressure medicine, and he said, an aspirin every day, 1 aspirin a day, and your blood pressure medicine. Keep on that, and let's bring you in for a checkup, in a couple of weeks. He goes, I want you to follow up with your primary care because we need to look into this a little further. So I says, okay, he goes, give it a couple of weeks. So a couple of weeks went by, but, it was the first time I've ever taken blood pressure medicine. So I kind of went through the motions of that. And when you take blood pressure medicine, some don't react well with you. So, the first one was I was just having migraine headaches I never had in my life, the worst, like the absolute worst. So we kind of played around with a couple of different medicines, a couple of different dosages until we got this one. And finally, I can take this one and function without issues. And that went on for a few weeks until I started feeling better. So I finally ended up taking that medicine and kind of adapting to it, acclimating to everything. And then I followed up with my primary, and we went in and we had a couple of visits, and we talked about what happened, and they were going over my charts. And At that point, it was like, okay, my primary says, let's go ahead and they said, it's been a while since we've had your scans. Let's go ahead and do the complete body scan again that you had 5 years ago. We want to see what's going on with that, because we do see that she's had a bunch of aneurysms. No one's ever really addressed that. So I do the body scans, and we come back, and a couple of doctors, different doctors, primaries I've had in that time period, because at times you can't always see the same doctor, right, in the office. So they were collaborating, I guess, or whatnot. So I would go and see the other one, and they came to a consensus of, we're going to send you to a specialist. So they sent me to a vascular specialist, and vascular specialist in Riverside. She really knows her stuff. She was really good, pleasant to work with, and really thorough. She asked for as much as she could as far as ultrasounds on my stomach, CAT scans, MRI, as much as she could without putting me in more danger, right, because of all the radiation and whatnot. So she wanted to limit the type of x-rays and how many I got. But she got as much as she could and as much information. She comes back and says, I see there's stuff going on, she was, it's like a shot onto left field. I want to send you to a genetic specialist because I want to have you scanned, or I want to have you tested for something. And I don't, at that point, I'm like, I'm listening, but I'm zoning some of the stuff out just because of fear, I guess, or what it may be. Maybe some type of fear. So I know something's wrong with me, but I'm not comprehending of the details of it. And I'm not wanting to soak in what she's telling me. I'm just hearing the direction of like, okay, I'll need to go to this doctor and get tested or whatnot. So I'm not sure if she actually explained to me what she was going to test me for exactly and the details of it, because I had no clue of VEDS and I've never heard of it before or anything. So she just told me she was going to send it to me, and what she said after that was kind of one in ear out the other. So basically at that point, it's wait for the genetic specialist office to call me, set up an appointment, and go see them. This was probably in March, I believe, or April. I think it was April I actually got tested, and then May when they told me. So I wait a couple of weeks. They call me, and I get in. I get an appointment scheduled, and I go in to the genetic specialist in Kaiser, and we sit down and we talk, and he tells me, and he explains to me again on what it is. He didn't actually tell me that, like, the medical terms and the medical names and the references of what it was he was testing me for. He just said there was vascular diseases, that a couple of them that he wanted me to test for, that might be an issue, that might be the cause of this, without getting into too much detail. He mentioned that because I was so healthy, I looked healthy previously, that I didn't show signs of or symptoms of that genetic disease. But it's funny. I look back now, and I think you and I had this conversation before, and when you had mentioned skin breaking, I think back now, and I was like, when I was little, and I told you about me being allergic to chalk, the chalk issue when I was in school. Well, when I used to touch chalk, I would have been in first, second grade, and we had chalkboard, and we'd write on the chalkboard. I'd go home a couple days later, my skin would break. Yeah. My fingertips, and my mom would actually have to put cream on my hands and gloves. But no, there was no knowledge of that, but that's what used to happen. So he goes, I'm going to test you for some stuff, and we're going to come back. And I asked him, I says, well, what do you guys test for? He goes, well, we test for they're going to test you for a lot of stuff. So what's going to happen is if you come up and you're alerted for a specific gene, it'll show positive, right? And I says, okay. So I got that call a couple of weeks later, and yeah, it was him. So he called me in, wanted to talk about my results. I go into the office, and he starts telling me that I was positive for this. And again, I had no knowledge of it. I didn't know what it was. I didn't know any details about it. Never heard of it. So I stood in silence, really. I didn't know how to digest it. I digest the information.
What did he tell you about it?
He was pretty empathetic. He broke the news well. I can say, kept it, as far as, I know this isn't what you want to hear. I'm sorry, but this is something it's a vascular issue. And he started saying, he told me a little bit about it, as far as basically what it does is it makes your veins and arteries weak. Didn't go into much details about it and the name of it. And then he told me, you need to change your lifestyle to accommodate this, and you need to make sure you're keeping on top of it. And I'm like, what do you mean change my lifestyle? He goes like, you immediately got to stop the CrossFit. You can't do that anymore. He goes, you can't weight lift. And I'm like, what are you talking about? So basically I can't live a normal life. And, he told me, he goes, well, you've been living a normal life, but you got to make a few adjustments as you're going to get older. And at that point, that's, when the grief, that's when it kind of started sinking in. Luckily enough, my vascular surgeon called me in after I got tested, and they found out, and she gave me some more details about VEDS and whatnot, and about what it is, and what to do, and as far as what not to do. But the thing is, I still felt like I knew nothing. I knew absolutely nothing about it. It's like, yeah, you're telling me I can't weight lift. Yeah, you're telling me I can't CrossFit. You're telling me I can't go and jog anymore. Or I can jog, but it has to be very, very lightly. And it can be not, no marathons or anything like that. So you're basically taking everything I want to do, and I can't do it. Why? Why can't I jog? Because my arteries are weak. So what? Okay, what's going to happen? I didn't know the details about it. I just knew that that's the way it was.
How did that feel? Like, how did you move forward with that? Because, like you point out, you had been doing CrossFit, you were active, you were weightlifting. Even years before, when you were diagnosed with these aneurysms and then had the stroke or the mini stroke, at that time they were just, it seems like, okay, you have these things, we're not going to look into it, and merrily you go along your way. And then this time it's totally different. Like, how did you move forward from that?
So I think the immediate time period, I didn't take it well. It was more of one of those things of, I didn't take it as serious as I should have. I just was like, okay, maybe I won't do the CrossFit, but I'll still do things, and it's not a big deal. I've lived this long and I'm healthy. And that's not the case at all, because what happened while I did that, I wound up in the hospital again. I think in January, or what it was. I think it was January. I wound up in the hospital, and that doctor was like, and I was visiting in Mexico at the time, so I wound up in the hospital in Mexico even. And that same day, because I was throwing up blood, they did a CAT scan on my stomach. I had told the doctor, well, I didn't tell the doctor, I told the nurse, but when they took my x-rays, he came back in and he goes, they immediately knew. It didn't take them weeks or anything. That doctor was older, so he had much more experience, and because he was a lot older. So I'm sure he's seen a lot more than some of the doctors I was working with here. And from the sounds of it, he had been exposed to a lot more and worked in a lot of other areas in the world. So, but he immediately knew. He told me, he goes, you have a vascular disease. And he goes, and it's very rare. And I go, yeah, I got VEDS. And he goes, you shouldn't be, he started like, you should not be drinking, you should not be partying, you should not be not eating. He goes, don't eat chili. He goes, what's wrong with you? And I go, well, I just found out last year. And he goes, nah. And so he explained to me. So I wound up in the hospital for a hiatus hernia. So I had a hernia with my stomach. And it's funny, I mentioned that. And I met a nurse later that had told me that it was common amongst individuals with VEDS. And I was like, oh, wow, I would have never even known that. So that's how I wound up in the hospital in Mexico. And so what happened was when I had the hernia and I threw up the blood, he had explained to me, he was, a lot of your blood vessels bursted. You had all those, and those are aneurysms, right? So he said they just bursted. That's what happened. So that makes sense. So at that time, I started taking stuff serious, and I says, okay. I came back from vacation, I buckled down, and I started going into the doctor and let him know I had the hernia. And, we started just focusing on me and just keeping up with my vascular surgeon. And my vascular surgeon, when I had told her about it, she goes, I'm going to put you on a plan. Every year, we're going to do full body scans once a year for you. So I did that this year in, I think, March, what it was. So I'm doing it around February, March. And she goes, we'll be doing that from this time forward, right? So that's where I'm at.
Yeah. Did you need any surgery on any of your aneurysms before, or have they remained stable? Like, where are your aneurysms and what is being done about them, I guess is the real question.
So all my aneurysms are in my pelvic area. Right now, my iliac, which is my left thigh growing area, is actually very large. That we're already in talks of surgery on mitigating that, whatever it is they're going to proceed with. I'm talking to Dr. Shalhoub. We actually just sent over my release forms and stuff so they could, or signed all my forms so they could pull my medical records and work that out for an initial intake type of interview so we could see about surgery and stuff like that. But they're telling me that it's growing at maybe a centimeter a year. And I had the talks of that with my vascular specialist. So with that, with the last, not this x-ray round, but the previous, so last year, during the diagnosis round of x-rays, she had caught that and said it was pretty large. So she wanted me to go talk to their Kaiser's surgical vascular specialist. She's a surgeon too, but she said she didn't feel comfortable taking that type of project on. So she wanted me to go talk to someone that was more seasoned, another doctor that had maybe more exposure and experience with it. So I went to that one, which is in LA Kaiser in West LA. And I guess that's their specialty cases for Kaiser. And I spoke with him. He took my x-rays and he said, the same thing. It's at about a 3.6 centimeter. He goes, for your size, he goes, this is the time we need to talk about surgery and repairing it. But, unfortunately, after talking with their group and their specialty, their team, they felt uncomfortable to do the procedure. So before that, I had already been working with the Marfa Foundation, and I had already reached out to them and got in touch with the Marfa Foundation and Jan. And Jan is the one that gave me all the resources and contacts for VEDS knowledge and whatever knowledge they have, right? And contacts, which as much as what they could. And she's actually the first person that kind of gave me some knowledge and some reassurance, that being proactive and keeping on top of everything, you can still live life and it can be enjoyable. There are times it may be a little rougher than normal. And she's like, you're not going to die tomorrow, which I appreciated. It really gave me a lot of relief. She was the first one. So I had already been talking to the Hoag Hospital, and I met with in the vascular department, and I met with all of them. The whole department is by far, I will never forget the department. They're the greatest, everyone in there. So I appreciate them. So I met with Dr. Liang and everybody, all the nurses, and Dr. Liang is the one that mentioned when I had told him about the my iliac artery and the surgery. He's the one that told me a lot of doctors are probably going to feel reluctant about working on you. He goes, but we do have a surgeon that actually has a lot of exposure and is seasoned as far as working on doing these type of procedures with individuals with vascular diseases. And he goes, she's great. And she's done iliac surgeries before, if that's the case. And I says, yeah. So we started talking about that. So this was prior to the meeting with him, the surgeon in Kaiser in West LA.
Got it.
So I had mentioned to him after he said that, I says, well, I know of another vascular surgeon, I don't know, you say place, but hospital that they're willing to work on me. They got knowledge with this. It's called Hoag Hospital, and I've already spoke with them, and they said they would, take on anything that I need. And he was understanding. He was very understanding, very acceptance. He had asked me the doctor's name, and he goes, I'll get you a referral over there. He goes, that's great to hear. He goes, yeah, if they have experience with this and they're willing to do it. He goes, and they know, that they can have an success with it. That's great. And I says, yeah. He goes, maybe, they can talk with us and we can learn from them. So I gave him the doctor's name, and he actually did send the referral over right away, which I appreciated. And so we hadn't actually moved forward with any of that yet. We kind of just had an initial consultation. I met Dr. Shalhoub at the Marfan Symposium. I think that's what it's called, but it was the symposium in Oregon. We met, and it was just brief during the dinner. We didn't get to talk, but she had said to send all the information over, and she would take a look at it. And so I'm just now getting around to it. So this is where I'm at now.
Yeah.
As far as that's the only surgery that I'm looking at you presently. Not to say there won't be anything in the future, because at this time I'm living with a lot of aneurysms. I think they had said 1 to every organ, but they're not critical. I want to say they're just something to look at and to pay attention to in the background.
Mm-hmm. I just want to take a moment to shout out pretty much everybody that you just mentioned, between Dr. Shalhoub, Dr. Liang, Meg over in Dr. Liang's office. She's been on the podcast before and works with him and has VEDS herself, and all of those people are amazing. And Jan Lynch. Jan, if you're listening to this podcast, you've done an incredible job connecting people and giving them information and, making people feel a little more stable, I think is what I heard, right, Carlos? Just a little more like, okay, take a deep breath. Like, we're going to move on from this. We're going to figure out how to make it work.
For sure. Definitely a breath of fresh air, for sure.
Yeah. Jan, you're amazing. All of y'all are amazing. Shout out to all of y'all. I'm so glad that you were connected with Jan and then with David Liang and then Shireen Shalhoub. Like, they're all amazing people. So I met you at that conference in Portland, or the symposium in Portland. What did it feel like meeting other people with VEDS?
Bittersweet, right? You don't want anybody to have this, obviously. This is not fun. But to know that you're not alone and that people have an understanding of, how you feel physically and emotionally. I think the emotional is probably the more important. But, it's hard for people to understand, that don't have this. I'm not saying that other people don't have other issues, but if they don't and they don't have this, it's hard for people to understand the small aches and pains that you live through that you think is normal. And it's not. I didn't realize that me having sharp pains in my stomach or in my side area or my back, I just thought it was normal, and I've always shut up and not complained about it. I just living with the pains is normal, and it's not. Like I said, it's bittersweet, and it was great to meet everybody. Everybody was just so welcoming, and I like to think that a lot of people, a lot of us that do have it, the reason why is because we know there's a lack of knowledge, and we know how tough mentally it can be if you don't know what's going on and you don't understand it. I think that's the bigger issue, right, for an individual.
Yeah, for sure. And I think just want to make sure that we, that after you were diagnosed, like when we talked before, you said it changed the way that you thought of yourself. Like it changed, like you had thought you were healthy. Like, do you want to expand on that feeling after the diagnosis?
Well, the only thing I could say is that there was this brief time period when I thought that I wouldn't be able to do any. I thought I wouldn't be able to do. I was just broken as a person. Like my body, just physically, like I'm no good. I'm broken now. Like, what am I gonna do? What can I do? And that's tough for someone to take on. And the messed up thing is, people that have temporary injuries, I'm sure they go through that too for a short period, but it'll heal and you'll be all right. For us, it's a little more tough because we know that as of right now, there's no healing. There's only preventive maintenance, right? There's just keeping an eye on it and trying to stay as healthy and fight as you can.
I think it's a good way to put it. We have a lot of research to do to find a treatment that will prevent us from having to deal with these kinds of things. So you were diagnosed with this, and then, you're going through all of this monitoring and figuring out the surgery on this iliac and when is that going to happen and who is that going to be with and all of that. And taking in like all of this information. I think it's been about a year, a little more than a year maybe since your diagnosis, right?
Yeah.
Yeah. So just like rapid change of before and after, and then you go to the symposium and you're meeting people and you're hearing about research, and I guess like what are your takeaways from where we are right now and where we should be?
Well, obviously we're still at the starting line for us, as far as having a lot of accurate data and put in one place, for us to understand and accuracy. And also to be on the same page. I know at the symposium they had mentioned that there's clinical trials that are going on in Europe, or not even in Europe. They're actually past clinical trials, and they're already having treatments that they say are effective. We don't have the data and we don't have the understanding here because we are not a part of those clinical trials. But there was one that was started before COVID. I know that it stopped, but it has started up again. And when we went to the symposium, they had mentioned that it stopped, and they had knowledge of it. They didn't have knowledge that it started up again. But I had actually just received an email a week prior to the symposium about if I was interested in being a part of it, because they were starting it up already again. So I'm moving forward with that. And it's the clinical trial for, I'm not sure if you know the name of it. I don't know the name of it.
I think that's the one for celiprolol.
Celiprolol, that's what it is. So I'm definitely keeping in contact with them. I'm moving forward with that to see how that works and if I'm actually going to get started. I know I've already been approved. They're waiting on my medical records, and I hope you would look into that, maybe consider it and look into that yourself, and all of us. If it's something that one of us are willing to do or want to do, definitely it's good. Something to look into. I also looked into stem cells. With stem cells being, I want to say there's almost no data on it that's actually public, or very little data. There is data that, different universities have publications for it. You can research that. It does help a lot of autoimmune diseases and repair organs and joints. But it's not a cure, right, for us. But as far as for me, the research I was looking into was something that would make me feel comfortable and help me prolong or forego any issues that I would have till I'm older, right? We want to live that long and good quality of life. That's our goal, right? That's everybody's goal. You want to live to be old in as best quality of life as you can have. So with stem cells, I was looking into that also, and what I found was I talked to a couple different agencies that do offer the treatment, even here in the U.S., here in Mexico, and their belief, which there's not enough data gathered around for any of this to be true, to be set in stone that is true, but there is data, and it has been compiled, and some of it has been proven just for real life experience, right, and real life cases, where it does repair, your pancreas. It repairs, people will do this IV treatments, and some of your organs will be well again for, I don't know if it's temporary or permanent, but I know it happens. And also they believe that what it does is because and again, you have to have it, they do it in different, I want to say different ways of giving you the treatment, whether it's injection or whether it's IV. So their belief is if they give an IV treatment, that the stem cells and the exomes will flow through the body, and even the exomes, as tiny as they are, will go ahead and get into different areas of your arteries or the needed areas of your arteries and veins and blood vessels, and repair the the weakened walls, basically kind of hold up the structure like a barrier and strengthen that, right? Again, I don't know whether it's temporary or permanent. Most likely it's temporary, but if it's something that can help temporarily, I'm all for it, right? Because I go through the pain and I know what it is.
Yeah, that is so interesting. That's like, I haven't really heard of that being used in vascular EDS, and I'm interested to read more about it. So I will, for our listeners, I'll dig up what I can find and put it in the show notes so that, you can check it out if you want to. That's so interesting. And, I think overall research we have so much more to do than where we are right now. What?
For sure.
Yeah. Were there signs, like you mentioned earlier, the skin tearing from the chalk when you were a kid? Were there other signs growing up that you now know are associated with VEDS that you had?
Not necessarily, because I guess it was the lack of knowledge of what to look for. I couldn't tell you. There probably were. I just don't remember. The one thing I do remember is about my skin breaking, because it was often, and it lasted, until I was almost a teenager, and it didn't stop. I don't know why it stopped when I was a teenager, but it did. And, but also I learned to stay away from chalk and dry things too, right? And like whatever dried my skin up, I learned to stay away from. But I couldn't tell you. There's certain things that I notice now that I've been around other individuals with it, that we have common. We have things that are in common, maybe like my smaller mouth. I always thought that was normal. It was because of my dad, but you look at my brother and my sister, we do look alike, like the upper face, but not the bottom, right? And they were talking about the symposium about mouth shape and the top and the bottom and the top arch or whatever. And I noticed that's common between us. Some of us have that. Facial features. They're just slight, but if you really, really notice them, they're minute, that they're there. But other than that, growing up, no, I couldn't tell you, because I didn't know. I didn't know what to look for at that time. And it's so far back, I don't remember it.
Yeah. Do you have any advice for someone going through either what you're going through now or something that you've been through related to your VEDS diagnosis?
Yes. Pay attention to your health. Pay attention to the littlest thing. It doesn't matter what it is. If you're young, you can probably get away with it. But as you get older, if you feel something's not right, it doesn't matter if you feel like it's a waste of time or if you don't believe it. Get a checkup. Make sure. And then doctors are people too. Even though I've met some of the most brilliant people that I've ever met in my life, to be human is to err, right? You also, if you feel like something ain't right, speak up, let them know, hey, maybe you should look into that more for me, please, because I don't understand it and I don't know what it is. And if you say it's there and you don't know if it's serious or not, maybe it is serious and we need to look into it. Speak up. Also, if you do have it and you don't know where to look or don't know who to talk to, Marfan Foundation, please call them, get in touch with the resources, reach out to your local resource hospital. I'm sure they have a Facebook page. I'm sure they have a group that they get together and they hang out, like us, we have a group chat, like we've talked, we've met. I'm sure they have that. That way you don't feel alone, and that way you can also gain some more knowledge and accurate knowledge, because of what's out there on the internet is really old data. There's very little that's updated, I should say. Most of it is old data. So what you're going to find may not be as accurate as what it is now. And it may not be as scary. It may enlighten you and put a positive spin on this and your life.
That's great advice. I'll put links in the episode show notes for the foundation and the support groups and things like that too. That's wonderful advice. For the medical professionals listening or the medical students listening, is there anything about your experience living with VEDS or just in general about VEDS that you want them to know?
I'm not sure I have the capacity or the knowledge to even give them advice or tell them, what could they do or what couldn't they do better. I think what they're limited to, they are doing what they can. I know we have those three regions that are working hard, I guess, right? As far as to find out information and pull stuff together, right? I think it's Oregon State University, Jon Hopkins, and in Texas, I believe, too.
Yeah.
To my understanding.
Yeah, Baylor and I think UT and Baylor are the same thing, and then there's also the University of Washington. But yeah, I think those are probably the main regions. There's some doctors in New York that are pretty familiar. There's Mayo Clinic in Rochester. There's a lot of different hospitals now where we have people who are knowledgeable about VEDS and Marfan and Loeys-Dietz. But I think the major research is, as you mentioned, coming from like 3 or 4 areas plus Europe. Yeah.
I guess the only question I have is, with all the updated technology, and I'm in IT, and with AI, like, where are we at with that, and implementing that in a strategy using AI and helping as far as speed up process, speed up gathering the data, speed up the answers to the questions and the solutions that we have. Where are we with integrating that technology? And I actually asked at the symposium, I asked one of the doctors, and she had laughed about it. She said, "Yeah, that's the hot topic right now." She goes, "But we don't yet, and we haven't, but it's being talked about." And I'm like, "Why are we talking about this?" Because I know there's other, I want to say, issues it is being used for in the medical field, because it is being used in the medical field. Right? I mean, it has to be. I don't have that type of exposure to it to know for certain, but I know it has to be. With all the new stuff they talk about as far as how they've sped up with COVID treatments, with other treatments, they've gone down from 10 years to 3 to 5 years, from finding answers to solutions and even speeding up progress, so speeding up approvals, right? So why is that not being used for rare genetic diseases? And this itself, VEDS, I guess I had that question. So I guess that's the only thing I would ask our health professionals is, where are we with that, and how can we help, or how can we implement that to help speed up these answers to these solutions?
Yeah, I think that's a great thought to kind of leave with the medical professionals listening and the medical students and the researchers listening. I think it's a great thought, both, why aren't we doing this? How do we do this? Is this applicable to our research in VEDS? And how, as, someone with VEDS, how can someone with VEDS help this process, help this research, help make sure that progress is moving forward, right? I think those are great thoughts to leave the medical professionals and researchers with. Good thoughts. Well, thank you so much for coming on and sharing your story, especially so soon after your diagnosis. I know it's been about a year, but in the grand scheme of things, I know a year is not very long to be living with this knowledge about VEDS and figuring it all out and meeting people for the first time and doing everything that you're doing now. It can be overwhelming. And I really, really appreciate you coming on to share your story.
No, thank you. I mean, I appreciate you allowing me to be on here and tell it. I'm glad I could do this. I never would have thought about it or even had the courage. And for you to invite me and kind of hold my hand through the entire process and to do this, it's really cool. I appreciate it.
Yeah, of course. If you're listening and you're newly diagnosed and you're trying to find resources, as I said, there's going to be lots of resources down in the bottom. But thanks again, Carlos, and I'll be wishing the best for you for your upcoming to be determined date of your iliac procedure and all of that.
For sure. Thank you.
Thanks for listening to this episode featuring Carlos Horn, sharing his story with VEDS. If you're ready to meet others, get involved, or need support, there are links for you in the episode show notes, as well as information on how to sign up for the VEDS Collaborative, a research study for people with VEDS, Marfan, and Loeys-Dietz. If you like this show, be sure to share it on social media, or even better, give it a rating or a review. You can also support the production of this podcast by joining my Patreon or by buying merch. As always, my top tier patrons are listed in the episode show notes. If you want to be on the next season of the show, there's a link in the episode show notes to get on the pre-interview calendar, and I'll be starting the interview process for next season in September. In the next episode, we'll be talking to Erin Langley about her story with a VUS. See you soon!